Um, you go to the next slide.
There we go.
There you go. So kind of why is this important? So the average number of hours in a school day for the state of Tennessee is 7 hours. And if they're in school for 180 days a year, I calculated today, if your child were to go from kindergarten to 12th grade, they would spend about 16,450 hours or 2,340 school days. And that's a big deal regardless of having a long-term medical diagnosis, but that's a lot of hours that they're away from you. And a lot of hours you're entrusting staff to make sure that their CF needs are met. And so that's kind of where I wanted to start from, of why is this important, and figuring out what are the best ways that we can support them through all of those years as they transition from elementary, middle, high school, and even on to college. So kind of our lesson plan for the night, we're going to talk about IEP versus 504, how to even establish a 504 plan in IEP, and then what do accommodations look like. And they kind of change as your child gets older. So I'm going to try to focus in on what they look like in elementary and middle school, and then what maybe needs to change in high school and college. And then another one that, at least for our center, we're starting to see more frequently is having multiple students with CF in the same school and or the same grade, and what accommodations and what ways can you work with the school to make sure that your child is getting the care that they need and making sure that infection and prevention control is in place. And then we'll look at managing CF and mental health in school, especially as we're seeing a rise in mental health among our adolescents, and then how to talk about CF with teachers and students and peers. And then at the end, we'll have time for questions. So IEP versus 504, if you've been a part of school for a while, you've probably heard those terms thrown out and maybe don't know what the difference is or when you need which one. And so an IEP is an individualized education plan, and this falls under the federal law IDEA, which stands for Individuals with Disabilities Education Act. And this plan is a written plan with goals and objectives, and it allows for students to receive a specific learning instruction accommodation due to conditions that affect their ability to learn. So this is more diagnoses like autism, dyslexia, if they have a speech or language impairment, an intellectual disability. These are accommodations to help assist them in learning. And that's why this plan has more like measurable goals. It might be that the student needs assistive technology or needs a one-on-one tutor. And so the IEP falls under more disabilities that require, they need a little bit of extra help helping with the learning part. And so we'll go on to the 504 plan, which is for at least most of our kids, CF is typically the 504 plan unless they also do have a learning disability. And so the 504 plan falls under Section 504 of the Rehabilitation Act. And this requires the student to have a disability that substantially limits a major life activity. And so as we're all aware, if we're here, we know CF affects a lot of major life areas. And so CF is a qualifying disability for a 504 plan. And this is a plan that really outlines how to support the student to have access to their education. This includes making accommodations for if they need to have more treatments in their day, that they can come in late. If they need extra set of books to have at the hospital if they're in the hospital. So the little bit of difference between them is we're not setting goals in the 504 as we would the IEP of like learning goals and objectives. We're really just outlining what are ways that the school, the staff, the nurse, the teachers can come alongside and make sure that your child has as equal an opportunity despite maybe having to miss more for appointments or illness, and making sure that they're safe during the day. So how to request one. This is a big partnership between you and the school and or your CF center. I really encourage parents to get to know the staff at their child's school because they're going to be part of your child's biggest advocates. And a great place to start is asking your child's CF center if they have a sample 504 letter. I have one on our next slide, but your center should have just a sample letter and it should include kind of an overview of what CF is, how it affects them, and then what are typical accommodations. And the letter is not to say they need all of these accommodations, but they're ones that through the years we've found that those are things that maybe your student might need at some point. And so starting there is a great place, and then reaching out to your school, whether that's your child's teacher, the principal, administrator, school nurse, any one of them should be able to point you in the right direction of who at your school can help you set up that meeting time. And so what they'll have to do is do an evaluation, which typically requires signing a release that they can get medical verification from your child's center. And then they would set up a meeting time that you can specifically write out your 504 plan of what accommodations your child needs. I recommend doing this before the school year starts because you don't want to get into a situation in the middle of the year when maybe flu season's higher or your child's out sick and they don't have this already set in place. And then reviewing it annually, because as your child gets older, you might need to make more adjustments depending on how much involvement they have in their own care. So this is just a sample of what ours looks like. And we provide it at every summer to all of our families, but reaching out to your center to see what maybe theirs looks like and getting a copy to take to the school can help start that process and help explain to the school what it is that you're looking for. So examples, so these are kind of more the elementary and middle school ones. Specifically, the enzymes are a big one that if your school hasn't had a child with CF before, this is probably a new journey for them too. And so your 504 plan can list instructions on how to administer the enzymes, explaining that it needs to be taken with all food, encouraging that there be limited use of shared classroom materials whenever possible, which in elementary school, that's probably more where that is something to be mindful of. Making sure your student has unlimited access to snacks, restroom, and water. I've attended some meetings in the past where they specifically write in the 504 plan, like Sarah needs to have a snack at 10 a.m. And that can be part of the plan. You can specifically outline out times. It doesn't have to be vague. This is really a chance for you to advocate for what you know your child gets at home and they need during the school day. So another thing is always allowing them to have a sports bottle of water. Sometimes that's not allowed for other students, and so making sure that's in there. And then this is a big one, especially with the pandemic, of just providing education that coughing is okay for our kiddos with CF, and explaining that doesn't mean that they're sick and spreading germs or have an active virus. And so putting that in there, I think, is important, and just making sure their teachers that they have during the day are aware of that, so that they're not isolated, especially with kind of the stigma that's come out of the pandemic. Next. And then attendance and tardy guidelines. I feel like this is probably the one that most people are concerned about when it comes to making sure the school is aware of needs. And so having that plan in place of what happens if they're sick and they're needing extra treatments, putting in the 504 plan that they may need to come in late if treatment times are taking longer, or they may need to miss out for more clinic appointments. And so coming up with a plan and communicating with them, whether that's you're going to provide a doctor's note every time, and having that open communication from the beginning so that they don't think that it's being taken advantage of, because we know that's not at all what it is, but explaining these are things that might happen, and these are things that we can provide a lot of documentation for, but we also need you to help us in accommodating for this. And then activities and extracurriculars, especially with recess, PE when they're younger, providing that education, including that in their plan, especially if, again, they maybe don't know that much about CF, letting them know that unless their doctor has said otherwise, that they should not be excluded from physical activity and that it's actually encouraged. And maybe if your child needs, that they need their inhaler before going out and running laps, you can have your office send in an order specifically stating, please have so-and-so have their inhaler 15 minutes before recess. All of that can be included in your 504 plan. Again, it's really just outlining what they need for specific activities, for specific parts of their day, and making sure that's communicated and taken care of when they're not with you. Another aspect is we're letting them know about their need for increased fluids and salt, and making sure that that's incorporated if that they're going to have PE and recess back to back. Really looking through their schedule when you go to the 504 meeting, and what you would do at home, and making sure that that's outlined in their 504 plan. So high school accommodations, the ones that we just covered also are part of the high school ones, but these ones I pulled out specifically that more so deal with them and not the elementary and middle schoolers. At this point, they're probably, going from classroom to classroom on their own. And so things look a little different. Bathroom breaks are normally more strict in high school. And so this is a big one, at least in my experience, of our CF kids coming in and saying their teachers aren't letting them go to the bathroom in high school, because that's typically sometimes taken advantage of at that age, but we know our kids need to be able to go do that. And so really providing that outline in their 504 plan that they need to have unlimited bathroom breaks. And this can be open communication at the meeting, if having like a signal with the teacher. Your child can come up with, hey, I'm going to wave at you, and that just means I'm going to do this. It can be they need adjustments in the curriculum if they've missed or have had hospitalizations. And luckily, with one good thing that has come out of the pandemic is they can offer a lot of virtual, but having that plan in place of what does that look like? How are they going to access their classes and their projects, and kind of communicating that ahead of time. Again, the standardized testing is going to be more for high school, and so they need to be able to leave without asking, and they need to have water and snacks. So including that in the 504 plan, especially junior and senior year, when they're going to be taking more of that standardized testing and making sure that those accommodations are in place for them. And then this is Tennessee Code Title 49, and this was actually amended in 2015, and it allows students with CF to self-manage and self-administer their enzymes without having to go to the nurse. And so we typically provide this letter for high school students, high school age. The school still requires a medication form, just indicating this is their prescribed dosage and they have been approved to self-administer this on their own. But I know we've had some schools that still are kind of wary of that. And so providing this information, asking your CF center, they should have a letter that explains what this amendment allows, and communicating that to them. But that is something that they are allowed to do and that this title protects them. And then college accommodations. So kind of the whole route this evening. And kind of first question I get is, where do you go for accommodations in college? And typically there's different names for it, but Student Disability Services or Office of Disabilities. And they are a great place to start. And some of the accommodations that are specific to college, especially, are if your child's going to be living on campus, starting this process as early as possible, but requesting that private room. All the medications and all their equipment and the time that takes. And I know some parents have expressed feeling like they don't want their child to be viewed as spoiled or like getting this room by themselves, but really you're also taking into consideration whoever that roommate might be, of the time and the noise that the vest and the nebulizers make, and also just the privacy for the bathroom and having a fridge for medications that need refrigeration, and really coordinating with your CF center to provide that documentation. I know depending on the school, they can have lots of paperwork, and while that might be intimidating on the front end, I really encourage parents to continue to advocate and encourage their student to advocate for their needs. And this includes that they might need time to make up tests or complete assignments if they've had to miss. But across the board, again, just that open communication with your teachers, the college at this point, and expressing those needs that they need. So then more than one CF student in a school. We actually just had this happen this past August, where we had 2 CF patients that were in the same school and the same grade, which really kind of made our CF center kind of look at, okay, what are all the things? We've had 2 in the same school before, but not in the same grade. But regardless, these things apply. And so reminding the schools that they need to be a minimum of 6 feet apart. And so ideally, they're not going to be in the same classroom. And if they are going to be in the same classroom, it'll be at different times, and that those common spaces would be wiped down. Meeting with the school ahead of time, we had our coordinator went, and I went to attend the 504 meeting myself. And the school, I think we were both surprised how accommodating the school was. And so again, I just really encourage you to make those relationships with your schools, because I think they really do want to help. It's just helping them understand what is needed. And so for this instance, when you have more than one, going ahead and figuring out, hey, which bathroom is this student going to use? Let's make sure that they're not going to be crossing paths. Where are they going to go for their enzymes? We need to have 2 separate places, and that needs to be communicated. Plan for the shared areas like lunch, lockers, library, gym, art. And it does take a little bit of looking at schedules, especially when they're in elementary school and they're alternating all of those specials every day, but kind of road mapping them and helping make sure that they're not going to be in the same place at once, or having to use shared computers or art supplies right after one another, that there's separate times, or they're sanitized. And then managing CF and mental health in school. This is something I kind of added last minute of just thinking about. Again, they're spending a lot of their time at school, and we know with CF that there can be an increase for depression and anxiety. And so making sure that your student has a trusted support that they can go to during the school day. That's a great question to ask your kiddos. Is there somebody that if you're having a rough day, would you feel safe going to somebody at school? And that can be a teacher, a guidance counselor, a school social worker, staff member, but making sure they have a point person that they would feel comfortable if something was going off in their day. And then depending on where you are, some schools provide school-based counseling, and this is a great service, especially if you work or you and your partner work, it takes the transportation out of having to coordinate getting your kiddo to counseling. And so if that's an option in your area and that's something your child is dealing with right now, I really encourage families to look into that, because it can be a really big support and resource during their day. Um, and then again, just kind of instilling that hope and highlighting their strengths. I think talking to a lot of adolescents right now, there's a lot of pressure to have different achievements and success. And so you're the primary voice in their life, and that is a huge honor. And so just really being that voice of hope and highlighting what hope they have for the future and what their strengths are, and being kind of that advocate for them. And then for college, this one's huge because most of the time there should be a counseling center at the college, and it's typically free to students. And so this is a great way for college students to get counseling if they need it, and have that support right where they are. And then discussing CF with teachers and peers. So this has come up a little bit recently too, of how do I talk about this with my peers? I think she was specifically third grade. And so these are kind of two things that, one for the teachers, and then the Who I Am book, which many of you have probably seen before, and it's definitely more for the younger ones, but this can be a great kind of tool for kids to find their voice and being able to explain what CF is and how much they want to share with their peers. And then the Live to Thrive brochure is specifically for teachers. And you can ask your CF center should be able to get an order of those and give those to you. But it really walks through succinctly what is CF, what they can do to help make the classroom a safe place for them, and how to best support your child. And then this is from the Cystic Fibrosis Family Education Program. This was put out by Baylor College of Medicine. I love this handout, and I don't know if we can include a way to get to it. I'll have to ask Jolly, but it is perfect for probably elementary and middle school age children, when they're kind of at that age where they know enough about their own diagnosis, but when kids are asking, there's typically an element of embarrassment or I don't want to be different, I just want to fit in. And this has a great tool of, so on the left-hand side, it says things people ask about or notice, which is really that elementary age of why do you do that? I noticed something different and I'm curious. And in the right-hand side, it talks about what they can say. And so using this tool to role play with your child, to instill that confidence and finding the words of, okay, when they see me at lunch and I get asked this is how I can respond, instead of feeling shame or embarrassment or I don't even know what to say because this has just been my normal for so long. I don't know what to tell them. But really kind of giving them that tool to own a huge part of their life, and embrace and sharing it in a way that their peers would also understand. And it also kind of just helps your child's own understanding as you walk through this to figure out, oh, I didn't realize they didn't know that this is what that was for. We've just been doing it their whole life. I guess they didn't realize what it was for. And so this can be a good tool for that too, and not just sharing it with their peers or teachers. And then last but not least, questions.
Hi, everybody. It's Jolly. I will, let's see if I can jump on. Sorry if you'll hear my dog. We have I'd say about 5 more minutes. So if you guys have any questions, feel free to unmute yourself or put yourself on video or type them into the chat. And I'm sure Emma would be happy to answer them. Or if anybody just wants to share any insights or ahas from the presentation? I will say, and I put it in the chat, Emma, I think it's good to know for our whole community that as a mother of an elementary school aged son, I can imagine just the additional needs that somebody with CF will need. And so knowing that you guys were able to go to the school and go to that meeting with the family is so helpful, because I know as that new mom going in, you just assume everybody's going to just know what they're talking about, and you know nothing. And that's how I felt going into it. And so it's great to know that you guys were there. So thank you. And yes, I agree, Laura. Great presentation. Awesome. Well, if anybody has any other questions, and Chelsea said it was super helpful. So yes, very glad. We are recording this. Sorry, I jumped on the record a little bit late, but we are recording this. So just a huge thank you so much to Emma for the session. As this breakout closes, so that you all know, you all will return to the main Zoom room. And then that's where we will head to our next education night session, which is our care center reports. So thank you all so much. And thank you, Emma.
Thank you.